I have been blessed with health all my life. I cannot remember being in bed with a cold or a flu or ever missing work for 50 years. So I've been very active, and I'm also stay very busy, pretty much of a high energy person.
In 2007, Mr. Crutcher presented with a complaint of rectal bleeding and proved to have ulcerative proctitis, which is a limited inflammation of the colon. Despite therapy, he progressed, involving more and more of his colon developing strictures, to the point we were unable to even pass a colonoscope through the narrowed areas of his colon.
Once that hit me, it hit me very badly, and I went from 178 pounds to 138 pounds, and I was pretty much lying in bed comatose and with very, very weak for probably 2 months.
This interfered with his functioning to a great degree, and part of our relationship was actually discussing his illness and how he was going to have to deal with this, with no understanding on our part from the beginning as to how this was going to turn out. He had not responded to the medications that were being given. He had actually had allergic reactions to some of the commonly used medications. And finally, in 2007, 2008, started the use of infliximab or Remicade, which over the period of the last 10 years has been a life-changing, life-saving drug for this man.
I will continue to take Remicade infusion about every 8 weeks. It's about a 2.5 hour total time where you go in and sit on a lazy boy chair, and either with your computer or your iPad or your telephone or take a book.
We established an infusion center so that we would have good contact with our patients while they were being infused, so it is adjacent to our office. The infusions involve complicated medications. Patients have side effects. We need nurses that are very well attuned to the medications, other complications that may be occurring, and able to assess the patient.
Dr. Rubin is number one, he's a phenomenal physician. He's well known around the country. He's highly regarded. Bedside manner, I mean, he's a soft and gentle person. Since probably June or July of '08, I've basically been free of all these symptoms, and my disease, which is chronic, will always be with me, but it is in total remission and has been for 8 years, so it's not even a factor in my life. I mean, I don't even, other than I have to go get my infusion every 8 weeks, but other than that, it doesn't play a part of my life, and I certainly owe that to Dr. Rubin getting me on this regimen.